Good morning. Thanks for joining us.
Good morning. Thank you for having me.
Awesome. So what information do you want to highlight this morning?
Yeah, so I think what's really important is recognizing that, we all know that the COVID pandemic definitely influenced screening and access to medical care and specifically primary care. And so I think it's really important to recognize, get back on track, right? So for any of those screenings, but especially this month, we really want to focus on that breast cancer screening.
Remind us what age that women should start getting mammograms.
Yeah, so that guideline can kind of change back and forth, but the best recommendation is at 40 years old for the average risk female. So that's something to kind of determine with your doctor, whether that's your OB-GYN doctor or your primary care doctor, and figuring out exactly if you need to be screened earlier than that, depending on your risk.
Yeah. Can you talk about why it's so important to get screened? Because a lot of people will say, I'll just go next year. Tell us, as a physician, how a year can be a huge difference.
A year can make a huge difference. I've had patients that just within the height of the pandemic, things went missed and those cancer progressed. So, I think it's important that if you're not getting screened, then those things can progress to further stages, and treatments have gotten so much better and more effective that it's important that we catch it sooner so that we can kind of address it sooner.
Makes sense.
I think it was last year or maybe the year before we did a story about men getting breast cancer, and that's still the case, right? It's men can get breast cancer as well.
They absolutely can, yeah. About 1 in 100 breast cancer cases, so for every 100 breast cancer cases, it usually is about one man. So it's definitely something that can happen. Less frequent in men than women, but it's definitely possible.
And who would men call in that case if they discover a lump?
Yeah, absolutely. I would recommend calling your primary care doctor. So your family doctor, your internal medicine doctor, whoever's taking care of you and making sure you're doing your best and keeping yourself healthy.
Good.
I know with colon cancer they changed the age because they were seeing it earlier in men. Is that the case with women? Are you seeing breast cancer more at an earlier age?
It is, and I don't know if we know why we're seeing it at an earlier age, but I do know that screening has gotten better. So now if we can catch it sooner, we can take care of it sooner. So yeah, we are seeing it somewhat of a slight increase in younger people.
Okay.
And if there's a history of breast cancer in someone's life, whether it's their parents, their aunts, whatever, something like that, are those indicators where somebody might want to consider getting a test earlier rather than later?
Absolutely, yeah. So if you have a greater than 20% lifetime risk of getting breast cancer, so exactly all those things you mentioned, those are things that increase that likelihood of needing to get screened sooner.
Okay.
Gotcha. And where can people find more information if they want more ideas or just advice for their health?
Yeah, advice for health, I think going to your primary care doctors, having discussions with them, discussing that, getting what is some of our daily habits and how can we just be healthy to help, keep our bodies healthy. And then there are also many resources, whether that be the United States Preventative Task Force offers recommendations on guidelines for all different screenings, or the American College of Obstetrics and Gynecology, or the American College of Family Practice. Any of those offer recommendations and guidelines.
Awesome. Thank you so much.
Yep.
Yeah.
Dr. Fremarek, appreciate your time.
Thank you so much for having me.
You're welcome.